It's the end of an era at Rochester's Trillium Health. Co-founder Dr. William Valenti stepping down after a decades-long career.
I think that the future is bright in terms of the possibility of cure, of actually getting HIV out of the body.
The local research pioneer started his work during a time when HIV and AIDS were feared and stigmatized. Good evening. I'm Karen Edwards.
I'm Matt Malloy. Dr. Valenti spearheaded advancements that would help the world better understand and respond to those diseases. And as 13 WHAM's Daniel Finkelstein explains, he's now looking toward a new chapter in life. Daniel, good evening.
Good evening to both of you. Dr. Valenti's work is recognized around the world. Trillium Health saying tonight his research helped transform AIDS from a death sentence into a manageable disease. After decades on the front lines of the HIV/AIDS epidemic, Dr. William Valenti will soon step down from his position at Trillium Health.
The challenge in the beginning is, what is this? How is it spread? And what do we do about it? And both in terms of treatment and prevention.
His medical career began at the University of Rochester in 1977, serving as the first hospital epidemiologist at Strong Memorial.
What my co-founders and I said in the very beginning, 40-something years ago, was that if this works, we'll create a health organization that outlasts us. And we did it.
Dr. Valenti co-founded Community Health Network in 1989, spearheading Rochester's response as AIDS cases rose in our area.
We wanted to bring AIDS care out to where people are, and that's out in the community. And you really can't expect one organization or one institution or one hospital to do it all.
Dr. Valenti and his team's work helped support research that led to advances in treatment and prevention worldwide. Over the years, the organization evolved to become Trillium Health.
When you mention his name, Dr. Valenti and HIV, everybody knows of him and the impacts he's had both at a local level and then on that national level in terms of aligning priorities around ending the epidemic.
Dr. Valenti will no longer see patients after 2025, but says he will always support Trillium.
Be proud of this community, because people here respond to crisis and health crisis in ways that are productive and get things done. And the Trillium Health is just one story of community involvement to get it done. We have much to be proud of here.
Dr. Valenti tells me one of the things he's most proud of seeing in his career is the advancements made in early treatment and prevention. Matt and Karen, back to you.